an update. 15 days after the beginning of this emergency, I am here at the headquarters of PAHO in Washington, D.C., and I am, as I said, by Dr. Jarbas Barbosa, Director of the organization, Dr. Ciro Garte, Emergency Director, and Dr. Leonardo Hernandez, head of the Emergency Unit Department of Bajo. Also, from our office in Caracas, Venezuela, we have Dr. Armando De Negri, who is the interim PWR in Venezuela, and Dr. Liz Parra, manager for earthquake responses in Venezuela. We also have journalists with us in the room and also connected via Zoom. During the session, you will be able to ask your questions either live or using the Q&A button. Please tell us your name and the outlet you represent when you are sending questions via the Q&A and here in the room. Also, we have simultaneous interpretation in English, Spanish, Portuguese, and French. And now let me leave you with Dr. Barbosa again, the director of the Pan American Health Organization, for the update. Thank you, Ashley. Good morning, everyone, and thank you for being with us today. Today, I want to offer an update about the health situation and the efforts underway to respond to the devastating earthquakes that affected Venezuela this past June 24th. Almost 2 weeks later, our message is clear. The emergency response continues, and the needs of the affected communities uh, continue to be urgent. Let me begin by expressing once again my most sincere condolences to the families who have lost their loved ones, as well as my solidarity with all those people whose lives have changed forever because of this tragedy. Si- Since the very first hours after the earthquakes, the first responders, health personnel, and communities have worked tirelessly to save lives. I want to recognize the dedication and commitment of doctors, nurses, medical emergency personnel, ambulance teams, public health professionals, and all the people who worked in health facilities in Venezuela, many of whom have continued to take care of others despite the fact that they were also affected by this emergency. To health workers in Venezuela, let me say thank you. Your professionalism, courage, and commitment continues to make a difference in the lives of those affected by this emergency. The Pan American Health Organization, which is also the regional office of WHO for the Americas, has worked since the beginning of the emergency together with the Venezuelan health authorities, United Nations agencies, and humanitarian partners. PAHO has mobilized specialized technical support, relying also on our permanent presence in Venezuela, where we have an office with over 50 officers who've always worked in vaccination, disease elimination, preparation and response to outbreaks, and in all aspects of public health. And their presence in the country has allowed them to respond quickly and in close coordination with national authorities. Our support has focused on three immediate priorities: saving lives, maintaining the continuity of essential health services, and preventing additional health risks in the coming weeks. To reinforce the response, Bajo has deployed emergency specialists and supported the deployment of international emergency medical teams. At present, 12 teams are operational in Venezuela, and they are expanding the care capacity in the most affected areas. Coordination between health authorities, response teams, and humanitarian partners is essential to make the most of available resources and ensures that assistance reaches those who need it most in a timely manner. Bajo has established coordination mechanisms to strengthen the work and contribute to a more effective health response. Likewise, we have delivered 6 metric tons of emergency medical supplies from our strategic reserve in Panama, and we have provided support for vaccination, helping to protect the affected populations and maintaining essential health services. While the initial increase in trauma cases has begun to stabilize in several of the health facilities that have been evaluated, the health emergency is far from being over. The response is now entering a new phase, which is equally critical and is focused on stabilization, continuity of care, and early recovery. Hospitals continue to operate, although they face structural damages, limiting factors in their surgical and diagnostic capacity, and a growing accumulation of pending interventions. The priority now is not only to keep health facilities open, but to ensure safe and timely access to essential health services, including emergency care, trauma care, intensive care, diagnostic and imaging services, oxygen, essential medicines, and other critical services. Over 17,000 people are still displaced. Most of them are housed in 87 transitional camps. In these spaces, access to primary health care, safe water, sanitation, vaccination, and epidemiological surveillance activities will be essential to prevent new diseases or outbreaks of respiratory diseases, diarrheal diseases, and other diseases that may occur in such a situation. In the coming weeks, the greatest health risks may arise not only from injuries caused by the earthquakes, but also from interruptions in health services, overcrowding conditions, deficiencies in water and sanitation, and a decrease in access to vaccination and routine care. Maintaining vaccination, ensuring access to safe water and sanitation, and ensuring continuity of care for people with chronic diseases such as diabetes, hypertension, and others, for pregnant women, for the elderly, for children, for people with disabilities, and for those who require rehabilitation will continue to be essential. Safe and dignified management of the disease remains an important part of the response and support for affected families. However, from the standpoint of public health, the greatest risks after an earthquake are usually related to a disruption and interruptions in health services and access to drinking water, sanitation, hygiene, and vaccination, rather than to the bodies of people who have unfortunately lost their lives. Mental health is also an urgent priority after a tragedy of this magnitude. Attending to physical injuries is not enough. Thousands of people have suffered losses, displacement, and uncertainty. Health workers also bear a considerable emotional burden. Supporting their psychological well being is as important as taking care of physical injuries. And allow me now to share some final reflections in
While the
English.
emergency response remains the priority, we must also look ahead. Recovery cannot simply mean returning to what existed before. It must be an opportunity to build back stronger, safer, more resilient, and better prepare health services for future emergencies. The scale of the needs requires sustaining and expanding the response in the months ahead. To support these efforts, PAHO has launched a US 24 million emergency appeal to help meet urgent health needs through the end of the year. These resources, the $24 million, will allow us to sustain essential health services, strengthen epidemiological surveillance, expand mental and psychosocial health support, support rehabilitation, and restore the functionality of damaged health facilities. The international community helped save lives in the first days after the earthquakes. That solidarity must continue. Timely and flexible funding is critical. It allows PAHO and partners to respond where needs are greatest and adapt as the situation evolves. No single institution can respond to an emergency of this scale alone. PAHO WTO remains fully committed to supporting Venezuelan authorities and partners throughout emergency response and recovery. Our priority remains clear: to save lives, protect health, and support affected people and communities in their recovery, while strengthening the health services they need today and in the future. Thank you. Gracias.
Muchas gracias, doctor Barbosa. Tenemos varios periodistas conectadas en la sala, presentes, así que vamos
We
a
have
comenzar
several
con sus preguntas, si tienen.
journalists, and we will begin with their questions. If they have any, those who are here present with us, you can also send your questions on Zoom, on the Q&A, or raising your hands.
If you have any, please identify yourself with your name and the outlet that you work for. Yes, thank you.
Could I do it in Spanish? Soy Natalia Cabrera de NTN
Natalia
24.
Cabrera from NTV
Soy Natalia
24.
Cabrera de NTN 24.
NTN 24 is my outline. In Venezuela, even before the situation, there were being issues of lack of inputs and the weakness of facilities, health facilities, and scarcity of medicines. So how does this affect the situation right now in an emergency, given that there were already problems? Thank you very much, Dr. Ugarte. Yes, thank you very much. In fact, the situation before the earthquakes had been a situation going on because there was a situation in Venezuela with the migration of thousands of health professionals over the last years. This has worsened even more after the earthquake. So the scarcity of essential medicines and supplies was critical right after the earthquakes happened, and spaces had to be habilitated in order to take care of patients, things that weren't ready for this. Some of the hospitals expanded their facilities. The military hospital, for example, had the ability to respond to many trauma cases. Other hospitals also enabled some other facilities for treating trauma, but many of those health services in having essential supplies or medicines to provide a response during an emergency. There were resources that had been foreseen for emergencies in other parts of the country. They were sent to the places affected by the earthquakes. There were situations where we had 200 patients where only 50 beds were available. So, expansion of medical urgency care facilities and others have been set in underway, but we continue to work as the situation unfolds. Thank you. Thank you very much. We also have a similar question by Gabriel Bastidas from monotoriamos.com. It came through the chat. But Gabriel, if you have another question, please send it to us.
I don't know if there's any other questions from the room. No? Oh, sure. With the microphone, please.
Hi, thank you for having us. I'm Jerry Buscarin with the National Public Radio. I wanted to ask about the situation of the some 18,000 people who were injured during the earthquakes, and how PAHO is helping with their follow-up care and what that might look like given the situation on the ground and so many people being displaced.
Many thanks. Perhaps our colleagues in Venezuela would like to start, and then we can continue. So over to Dr. De Negri.
Yes, well, what happened in these very complex situations, and the first moment, there is naturally a moment where all health services were overcharged, no? And then the reserves that were mobilized in the country were applied to solve the flow of the patients and surgical treatment for many of them that needed that. So in this very moment, what is happening is that there are many different efforts in order to protect the more than 17,000 people that are in shelters or shelters that are still in process of being improved, no, and adequate for the needs of the population. At the same time, we are reinforcing, the answers made by the public national health system in order to keep the standards for public health managing of the situation. What means to stabilize the access to the services for the whole population, not only for the directly affected, to do the follow-up of the chronic disease, to keep open all the flow of the obstetric and perinatal care. At the same time, trying to improve through our emergency medical teams, combined with the national professionals from other regions, the combined efforts in order to recover capacity of the health service that are in the impact zone. We were reported that more than 15%, 50% of the health professionals of La Guaira region, the zero zone of impact, were affected, directly affected. Some are disappeared, some are dead, others are very much affected by the housing, impacting their families. So what we are trying to make now is to stabilize the follow-up of the needs of the population on healthcare, and same time complete the first wave of needs that are related with traumatic injuries and the follow-up of those patients. So there is a very complex situation still going on, but at the same time, we are looking for a more stable answer to those needs. Thank you.
Thank you.
Many thanks. We've had a follow-up question from Gabriel Bastidas from Monotoriamos. So let's see if we can give him the mic.
Hola, buen día. Gracias
Good morning, and thank you very much for this press briefing. I wanted to ask if there is any risk of cholera, leptospirosis, or other infectious diseases that would become different outbreaks in the areas affected by the earthquakes, and if you are taking preventive measures. Thank you very much. We also had a similar question from Reuters. They asked whether Dr. Barbosa said that in order to prevent outbreaks of diseases, you need water, clean water, basic services, and avoiding overcrowdedness in the encampments. Yeah, well, thank you very much for your question. No doubt, one of the concerns, in addition to responding to the imminent needs of those injured, is to guarantee that those who are being sheltered in the camps and transitional camps, etc., can have the necessary supplies so that there are no outbreaks. We are implementing protocols that exist for that. These are protocols that, while strengthening epidemiological surveillance, guarantee access to vaccines, to primary health care, for the people to identify if there's a case of influenza or any other disease, and access to clean water and sanitation. Among the more than 6 tons of material sent to Venezuela, we have some rush kits for water and sanitation, which includes substances that guarantee that water can be treated immediately while more regular water supplies are established. Yes, there are cases of cholera in the Americas and Haiti, for example, and cholera outbreaks are under control given the work that is being done by PAHO in the country. So there is no case of cholera in Venezuela, so we are not expecting to have cholera in Venezuela. What is more or most common in the shelters are respiratory or airborne diseases, So there's overcrowdedness, and so things can be spread more easily. Diarrheal diseases for lack of access to safe water and improper management and treatment of food. And so for all these occurrences, we do have protocols that are being implemented as we speak, as well as more sensitive surveillance to identify quickly whether there is any outbreak or any disease that requires attention immediately. But yes, it is a concern, and it's part of the response protocols that have been established in Venezuela right now. Thank you, Doctor. I don't know if our colleagues in Venezuela, Dr. Para, for example, would you like to add something? Yes, thank you very much. To add on to what the director says, let me tell you that we are working closely with the health ministry to reinforce the epidemiological surveillance system. And we have agreed in the past to enhance and improve reporting beyond the regular network that is used in Venezuela. This means to extend to other reporting units, to emergency medical teams that are deployed right now, as well as also to the temporary camps. So they are being part of the efforts to report events or likely events or possible events that may occur in these camps. Also, rapid response teams have been established in the temporary camps, and the reporting system is now more intensified to report as quickly as possible right now in Venezuela. And we're also giving significant care, which was also mentioned already by Dr. Barbosa, regarding respiratory diseases, diarrheal diseases, febrile syndromes, vaccine preventable diseases, and other things. I also would like to say that in addition to epidemiological surveillance, significant efforts are being made to strengthen research, quick research, and coordination between epidemiology lab teams so that early detection can be done of any event that is reported.
Thank you very much, Doctor. Now we are going to CNN. Mauricio, who has a question that he would like to ask live. Hello, good morning, and thank you very much for this press conference and also for having the possibility to ask my questions. The first question has to do with the hospital network. During the very first days after the earthquakes, the authorities in Venezuela reported that there were damages in 3 hospitals. I would like to ask about the status of those hospitals that were impacted by the earthquake and the hospital network in general, and also given the understanding that an emergency of this sort has an impact on all of the population. I would like to ask you whether there is any group within the population that requires more urgent care in the upcoming weeks so as to prevent any health issues. And those would be my questions. Thank you very much. Thank you. And I give the floor to Dr. De Negri. First, as to the impact on health services, the consolidated report indicates that 3 hospitals have had structural damages and they were evacuated. In addition to that, there are 24 other hospitals that were also damaged and their operation was also impacted, and they were repaired to maintain basic operations, and 20 other hospitals that had more of a superficial damage and that need to have repairs done. That is as to the hospital network. And for the outpatient services, we have 20 facilities that were impacted. They need to be repaired, but the operation has continued. But for the first level of care, that includes community services, more than 100 units were impacted and 20 of them suffered severe damages. This is our balance so far, and these are pieces of data that we are consolidating with the authorities, and we are conducting new evaluations in depth to see what we need to recover and do with each of them. It should also be mentioned that during the first 48 to 72 hours, there was a satisfactory response. Clearly, there was overwhelming of the services. And we also need to, in some cases, to better coordinate with the authorities, but this also implied that there was an incredible number of volunteers and also health workers who were sent to the area, and that also allowed for a reasonable flow of the patients within the facilities and within the health system, the one that has been the most impacted given the situation. And after the arrival of the international teams, we were able to reorganize some of the flows. And as I mentioned, we are right now stabilizing the various areas of care. As to the second part of the question, I give the floor back to my colleagues in Washington. I thank you. Liz? I think that the answer was quite complete. Thank you very much. We received a follow-up question from Reuters, and they are interested in having more information. They would like to know how you qualify the efforts so far to prevent diseases and what else should be done by the government. Dr. Barbosa, I thank you for the question. And I would like to add to the second question by the journalist from CNN who is asking about the population groups that need to receive priority care. In an emergency of this sort, we need to guarantee care for those that were hurt given the collapse of the buildings, but also the displaced individuals need to have safe conditions from the health point of view in the various shelters in which they are. But we should also call your attention to some groups of individuals who are directly impacted because they can stop having access to medicine and essential treatments. So those kits, those emergency kits that we sent to Venezuela, for example, include medicines for chronic diseases, because if a person who has diabetes stops having access to insulin or any other sort of medicine to treat diabetes, may have serious reoccurrence. So, and also those who have hypertension, individuals with chronic diseases, pregnant women, children, the elderly. Those are some of the groups that need to have ongoing access to health services and medicines to be able to have their health issues cared for without a worsening of the situation, because that will also imply further overwhelming of the services that need to focus on responding to the emergency. As to what has to be done, we already discussed that. First, we need to guarantee access to vaccines. Venezuela already had some indicators of vaccine coverage below what would be necessary. And now what is it that we have? For example, we have several children in transitory camps, and if there is a measles case, it could be transmitted to others, and the same happens with whooping cough. So we need to guarantee access to vaccination, and also in connection with the question from and what our colleagues from Venezuela said, we need to have a very sensitive surveillance system so that if we have a diarrhea cases, we need to identify, to carry out lab testing, to identify the type of bacteria, the viruses, and also the measures to be implemented. We need to work on prevention, and prevention is the most important aspect, together with access to vaccination, access to drinking water, and sanitation in the camps. And also we need to guarantee a prompt identification of any case that is striking that could be an outbreak so that it can be treated immediately. So we need to comply with all of the steps within this response to offer sensitive surveillance with lab capacity, integration with the health services, and immediate response. And this is key to avoid outbreaks. Thank you very much, Dr. Barbosa. We have a question by Bianca Aguirre from Radio Centro in Mexico, who would like to know the medical supplies that are required at this point in time in particular. Dr. Hernandez, would you like to take the floor? Basically, the list provided by the ministry includes supplies to complete outstanding surgeries and also medical reviews, and also those individuals that are undergoing mental treatment and non-communicable diseases such as hypertension, diabetes, as the director just mentioned, and to recover those missed treatments by those patients who are in shelter situation. I would also like to take this opportunity to mention that it is important to coordinate with health authorities to provide the supplies so that any deliveries have to do with what they need the most, with the proper expiration date, and also properly packaged and prepared by health authorities so as to guarantee the quality of the medicine. Thank you very much. Now we have a question from Bloomberg. Question. Early this month, PAHO put out an international call to collect $24 million to address the emergency in the upcoming months. It seems that Dr. Barbosa reiterated this today. We would like to know how this is going 6 days after the first call for funds. Dr. Ugarte, I thank you, Ashley, and I thank Bloomberg for their question. The call was intended for the very first months. Up to the end of the year, we were able to mobilize the disaster assistance fund of PAHO. This allowed for the deployment of staff and urgent supplies and medicines. We also received cooperation from the Humanitarian Assistance Office in Europe that also allowed us to reestablish some of those services, in particular, the mobilization of staff and supplies. PAHO also launched their emergency fund with $1.5 million that was immediately transferred and $1 million that will be sent shortly. And we were also able to mobilize funds from the Humanitarian Affairs Office from the UN. This is available to PAHO. It is expected to be 3 million, even though it is not confirmed. Canada also offered $2 million and Spain offered $1.5 million. So we have about $9 million out of the 24. And I would like to underscore that that call is of extreme urgency. This is not for rehabilitation. This is for response and recovery of essential services. So any contribution by partners is very important. I would also like to underscore that the response by the emergency medical teams of more than 20 countries to Venezuela is a key contribution because it also supplements Venezuela's response, and some of those emergency medical teams that have surgical capability will leave behind their facilities, their equipment back in Venezuela so that they can also be used during the rehabilitation phase. All of those teams are closely coordinated with the health network as it should be done. These are not independently established institutions, rather they are everything that has to do with information, patient transportation, and also the work within the health network is being coordinated, and that contribution should also be underscored. Thank you very much. I thank you, Dr. Ugarte. I think that Dr. De Negri will add to this. We are receiving also several questions on vaccination, including one by Mariana Suquet, who would also like to know how we're supporting vaccination to prevent epidemics in Venezuela and whether vaccines will be donated to the country. And also Ms. Hill from the Tal Cual newspaper is also asking something similar. Dr. De Negri, can you add to this? Thank you very much. As a matter of fact, from the earthquake, we were working on strengthening effective vaccination coverage in the country. We had a procurement team that had resources and working in Venezuela through our regional revolving fund to obtain the vaccines. And the expectation is that most of those vaccines will be arriving in the country in mid-July. And that also implies that the necessary response at this time led us to a call for donations. We received donations for tetanus vaccination, measles, and we also had a regional warning and alert as to measles outbreaks. And we were also able to strengthen a response to yellow fever, whose vaccination had been strengthened as of January. And we also had a general booster for most of the vaccines, and in Venezuela, in some cases, we were lacking essential coverage. So all of the efforts for the acquisition of vaccines was further strengthened with donations now, and as the countries can provide donations which are not for the full amount, they still help, and we're also speeding up the procurement process. This is a very important issue. Venezuela needs about $50 million yearly to maintain their vaccination coverage and structure, and this is also part of the resources that we will need to implement. This is part of this essential amount and also for early recovery of the capacity and the capabilities within the country. It is also important to mention that many of the weaknesses that we had seen in the health system that will be even worse now during this response to the earthquake are part of the work that we have been doing and that are also gaining speed now, and also the need for a response, in particular, everything that has to do with the recovery of the impacted individuals, everything that has to do with strengthening the clinical services and also blood services and outpatient services, and everything that has to do with the associated telecommunications infrastructure. This was also part of the report by the authorities, and it has to do with the use of the $24 million that we are trying to mobilize in addition to the resources that we are obtaining through the UN and other bilateral agreements in support for the country. Thank you. I thank you, Dr. De Negris.
Thank you.
Quería hacer seguimiento, muchas gracias nuevamente, justo a lo que acaba de
This
decir
is a
el
live
doctor Denegri.
follow-up in connection with what I just heard from Dr. Denegri and the amount in connection with the funds. Two questions. First, is there a consolidated amount? And what are the hospitals that are actually working? Because we have a listing that indicates that some had superficial damages and other had structural damages, but we understand that they are operational and also in connection with the disaster funds that were already disbursed for about $1.5 million and 9 million in total out of the 24. Venezuela is a country that, according to various NGOs and international organizations, there is corruption. So what is the concern about the actual use of the funds for the proper goals, and how can we make sure that the funds are going to make their way to those in need and to the population that actually needs the assistance, and whether there is any type of work by PAHO to make sure that these funds that are so deeply needed are not going to be used for other purposes. Thank you very much. Natalia?
Gracias.
As to the operation of the health services, Dr. Denegri will further refer to that, but as to the funds, all of PAHO's support for several years has been in coordination, very close coordination with all of the partners in Venezuela. We have more than 70 international partners, 43 of them are physically located in Venezuela, and all of the assistance is in coordination with the health authorities, but that has been directly distributed by PAHO, that is through a transparent mechanism that has a registry of all of the material that is being sent, all of the supplies that are being sent and used. So the funds that are being requested by PAHO for assistance purposes are to be used by PAHO Secretariat in response to the emergency. Other funds will be needed and will also help with the recovery of the health services, and Venezuela will need much more than that to be able to continue with the response, rehabilitation, and reconstruction. Maybe we're talking about tens of millions of dollars. So Armando, can you address the number of hospitals that are operational in Venezuela, please? As I had mentioned before, there are only 3 hospitals that are not operational due to structural damages. That means that in the area impacted by the earthquake, 7 out of the 24 states of Venezuela. As to the rest of the hospital network, we are talking about more than 50 hospitals. They are still operational, but as it has already been mentioned, a large number of these hospitals were greatly impacted over the last decade due to financial restrictions. So oftentimes we find that only some of their hospital beds are operational, and also the impact of the earthquake also allowed us to see this as a fragility. So when we're talking about increasing resilience and also strengthening the system, giving any need, any permanent need, or any need that is related to the earthquake, that also implies recovering the hospital capacity, but clearly only 3 of the hospitals were completely taken out of network, and the others were impacted, but they are addressing the situation given their capability. And now we're also looking into the whole health network within the community. That is to say, I already mentioned that there are more than 100 community facilities that were impacted, and they are key for follow-up of chronic diseases and also maintaining access and quality of access to health as part of a sustained response to protect the population. So this also has to be addressed we are focusing on hospitals, but we are also forgetting that the day-to-day follow-up of the population takes place as part of a primary health care strategy. Thank you. I thank you, doctor. And now we have a live question here in the room.
This is a little bit related. You've emphasized needs for patients with chronic conditions, as well as issues with just people who are displaced having access to clean water. But can you give us a sense of the highest patient caseload when they're presenting? What are the biggest needs right now? What are people hearing from patients right now, especially amongst the displaced population? Thank you.
Thank you very much. Liz, ¿podría responder? Por favor.
Liz, would you please answer?
Bueno, lo que estamos viendo un poco en el terreno es que
what we see
muchos de los pacientes están
on
necesitando acceso a
the
sus
field is that many patients do need access to treatment, and also those patients that have non-communicable diseases and chronic diseases, they still need continuity of treatment. They also need to continue rehabilitation, or, for example, some of them may need surgeries. So it will be necessary to continue with this. This is what we are actually seeing in the various camps, but also within the health facilities, those patients that are hospitalized, and also patients that need continuity of treatment, or patients who actually need surgeries at this point in time. Thank you. Thank you, doctor. Now we have a question from House Policy Watch, Amanda Magnani.
How is PAHO's relationship with government entities and volunteer groups during the response? And how are actions and responsibilities divided? Are you able to start, Doctor?
Yes, so thank you for this organization. PAHO is an international organization, so we work with the governments from Canada to Chile and Argentina. All the countries in the Americas are member states of PAHO, so our main relationship is with the governments, the Ministry of Health. But of course, that PAHO also works with a very important network of partners, philanthropies and development agencies that work together and provide support to our work. So in each country of the region, besides working with the Ministry of Health, we also work with academic institutions, we have collaborating centers, we work with non-state actors that have a specific process to establish official relationship with the Ministry of Health. Of course, that our main task in the region is to strengthen national capacity. We don't act replacing the Ministry of Health. On the contrary, we are in the countries to strengthen their capacity to prevent and respond to outbreaks, to reduce maternal mortality, to increase vaccination coverage. So we provide technical cooperation so the ministries of health, with support of their specific network of partners, can implement all the actions. In a moment like public health emergency of this magnitude now, this is essential, that not only the Ministry of Health in Venezuela is working, but that we are also supporting the Ministry of Health of Venezuela to strengthen and to increase this network of international partners. Several countries that have already sent EMTs, emergency medical teams, to Venezuela, that are making donations that we are facilitating, but also the partners that are on the ground, the partners that are in Venezuela, working together to provide more support to people that need at this crucial moment. Thank you.
Muchas gracias, doctor. Tenemos una
I thank you, Dr. Barbosa. We now have a question from Altagracia Ortiz Gomez on behalf of OI, and we also had some similar questions from Globovision and Benevision also. They would like to know about the epidemiological situation in the Guaira area, in the disaster area, and also PAHO's recommendation for the healing in Guaira, also waste management in the area, and also water management, etc. I will first give the floor to Dr. Denegri, please. Well, I believe that we have been able to also provide some early information on the epidemiological situation. But if we think of a disaster of this sort, it is first important to consider the impact on those that are openly exposed to the immediate impact of the earthquake. That's where we see the whole universe of individuals that were hurt, that had open wounds, lacerations, broken bones, that had that needed an urgent response, and that in many cases need follow-up. So this worsening of the trauma situation requires immediate care and also follow-up of the various injuries for complete recovery. And in some cases, there is a need for surgeries and subsequent recovery surgeries. And this also requires rehabilitation, the idea that individuals can recover fully. For example, a person who lost a leg or an arm now needs to rehabilitate, and this may take months until the person becomes completely autonomous again. And then we also have, for example, exposure to a situation in which there has been a lapse in environmental standards. So we have a level of particulate that has been inhaled, or individuals that have had burns, or there has been the release of toxic material, for example, with combustion. And now also, if we think of the camps, we also have here the exposure of these individuals to ongoing air pollution given the debris, and also exposure to polluted water and soil. So we have a critical impact, that is the environmental impact on human health and also on environmental health. So we have a whole set of care measures that, in connection with other UN entities, we're trying to determine how debris removal also implies taking care of dead bodies and also environmental management, and how we can move the material, how to transition all of this to a safe place without further polluting the water and the environment. And we also need to critically review and carry out micro mapping of the region. We have already started with this, but we need to now move forward with more knowledge as to how we need to relocate within these areas, including in Caracas, beyond La Guaira, so that we do not continue to build on areas that have a high risk of earthquakes, but also have better standards, safety standards in general, to address earthquake situations, and also expanded environmental management. And we also have what we mentioned before, everything that has to do with diseases related to a worsening due to exposure to infectious factors. And I already mentioned to the importance of strengthening vaccination, and also the concern in terms of biosafety for all of the impacted population, but in particular the transitional camps. And based on that, we need further epidemiological surveillance. The water issue is key. As we mentioned, the combined response by UN agencies and also international governments. We are focusing on water and also food safety and nutritional safety that become essential. From the point of view of the epidemiological situation, we still have 400 individuals that are in hospitals. Some of them are still recovering from these traumatic events. There is also a number that is being consolidated as to the number of surgeries and also individuals who lost an arm or a leg. And also we need to think, for example, of prosthetics and how we are going to reintegrate these individuals that also have chronic diseases, and those individuals that are not receiving care right now, so that they have the proper follow-up. And the final interesting comment is that now we are looking for a way to create in some of these transitional camps some structures to focus on those individuals that need care beyond hospital care, but integrated comprehensive care for a while, such as the elderly who are really weak, individuals who have chronic diseases, and also individuals who are undergoing rehabilitation due to important health impacts. This is what we're doing with our health authorities, and we're trying to find a way to integrate all of these individuals so that this is a need that is still being addressed. Thank you very much.
Tenemos un follow-up question para usted. ¿Quiere confirmar
There
el
is a
porcentaje de
follow-up question.
profesionales
Do
de
you
la
want to
salud
confirm the
Guaira
percentage of
directamente
health
afectadas? ¿Es correcta la
personnel that
cifra
are
de 50%?
directly
Una pregunta de Ángel.
affected by the earthquake in La Guaira region?
Debe ser
Is it
más cerrado,
50%?
doctor.
That's what you said. Is it correct? 50%?
No es un número definitivo.
It's not a final number. It's an estimation that is constantly being updated. Yesterday, we did a new mapping based on what the authorities had reported. And yeah, about 50% were affected, and a proportion which is not yet estimated of disappeared, missing, wounded, injured, dead, and to people who were not directly affected in terms of their living, but in the condition of their families, where there was total loss of their domicile and health care, mental health, which has been mentioned here critically. So there is at least 50% of the labor force which is not operational and is being covered by international cooperation, and also displacement of national professionals who came to the epicenter from other parts of the country. So we're coming to the end of the briefing. There's a question by Servimedia. They want to know how we are working with the country in management of the dead. Dr. Ugarte, Dr. Hernandez, please. Well, yes, the country and the country office are supporting forensic authorities together with the International Red Cross Committee to organize an institutional task force to manage the bodies. The most important thing is that it is a structural issue, from recovering the bodies, identifying them, temporary disposal of the bodies, and the genetic work to collect the DNA to be able to identify the bodies at a later date and give the families the bodies, and also to have a communications plan that allows us to inform the community what the procedures are, what's going on, why is it so hard to establish where the body was taken from, what precise building, taking samples, do anthropometric measurements, and do coordinated efforts among different agencies for the final disposal of the bodies. Those temporary burial sites are well organized, they are referenced, and they have all the backup information to support a later identification of the dead. It is a terrible situation with a high rate of mortality, and the work is being done, and it is very hard and challenging. Dr. De Negri, would you like to supplement? Yes, thank you very much. This is something that we are following very closely. We have frequent meetings with the National Service of Forensic Medicine. We've already offered material so that they can work well with protection and to rehabilitate the facilities and to be able to properly manage the bodies. Apparently, only 300, according to the review with the forensic authorities, had not been identified, and they had already been buried. As Leonardo mentioned, they're following all the orientation to know how to manage these bodies. If there is a certain time that has elapsed, there's a joint document, and there is a joint management document that comes from PAHO, WHO, and the International Red Cross. The bodies are numbered. There is a specific marking of where they are buried. DNA material is collected from hair, from nails, from teeth, and all of that is filed away. So at some point in time, if the family comes to claim the body or to and to have an identification of the people and know who's alive and who's dead, all of this is documented and well supported. Out of about 300, as I said before, about 300 were buried without being definitively ID'd, but they were all in coffins. They were properly managed. And at some point in time, you can go back and examine these bodies. As Leonardo said, this is a very difficult task, and people are in La Guaira, and they are doing the work. And there has been international cooperation to strengthen lab and genetic facilities and to receive some specialists to know how to do the later management of so much loss of life. We are following this closely together with the International Red Cross Committee, and we acknowledge the work which is detailed with restriction of resources, but the work that is being devoted to this issue. Thank you. Thank you very much. And now I give the floor to Dr. Barbosa for some final words. Thank you very much. Very briefly, first, I'd like to thank all of you journalists who have participated here in person or via Zoom. Thank you for your questions. We will continue to share the information that we find on the field. Our team is there. We have sent reinforcements who are working with our staff in Venezuela, and we are working hand in hand with the health ministry and with the organizations from the UN family and other agencies such as the International Red Cross and others who are providing support to the government in responding to this earthquake, which led to a dramatic situation for the country with not only complications for health matters, but also loss of life, loss of buildings, and creating great needs. And so we need to continue to think of the response that is being given on an emergency basis, but also looking into the future so that the health system in Venezuela can continue to operate with vaccines and other healthcare matters. I would like to thank all partners. We we have countries of the region and from outside the region have sent medical emergency teams. We think that they send just a couple of people. Many times they send a whole hospital with great surgical capacity, a serum immersion. They have their own autonomy. And when it's necessary, they have people specialized also in interpretation and translation. And this happened immediately so that trauma could be treated, save lives in Venezuela. And also important donations have been received from vaccines to other things from our region and others. I would like to thank all the agencies, the humanitarian agencies who have sent medical emergency teams. There is a movement of international solidarity, and our role is to work to coordinate all these efforts, because in an emergency, if we don't have good coordination, goodwill many times can become an extra burden for the country receiving support. So the great effort of identifying the needs and then providing cooperation so that such needs can be met immediately. And we will continue to work on the field with our Venezuela team, with the support of the departments here at headquarters. And I will continue to give periodic updates to the media, and we hope to have another press briefing soon to keep you updated as to what's going on in Venezuela. Thank you very much, Dr. Barbosa. We've come to the end of today's press briefing. Thank you very much, Dr. Barbosa, and our panelists here in Washington, and those who have been connecting via Zoom from Venezuela. Thank you to all the journalists who are connected and who are here. You can continue to send your questions or requests for interviews through media team at pajo.org. Thank you very much, and we'll see you in the next press briefing.